Welcome, everybody. Thank you for joining us on Taylor Tuesday. I am honored, actually, to be co-moderating this with Dr. Jeff DeSantis, our CEO. And I am not Dr. King, as you can tell by the picture. Dr. King had something come up, so I am moderating for him. And joining us is Blaire.Bendian. You know, I only call you by Blaire, and I never say your last name, Blaire. I'm not gonna say that I said it wrong. And Blaire is a sales executive for Provista, and I'm going to talk a little bit about her afterwards. I just want to thank everybody for joining us and tell you a little bit about Taylor Medical before we get started. We've been doing these webinars since pre-COVID, during COVID. This was something that we felt was important because Taylor Medical is not just trying to get you the best widgets possible. It's a family. We want to teach you how to do things. We want to do the right things that are going to benefit your practice. And so we've been doing these webinars, and they are archived on our website. You can go to the upper right-hand corner and click on My Webinars, and there's an archive of all the different webinars we had. This is not Blaire's first rodeo with us. She's been here before. And so this is nothing new, but you can look at all of the webinars that we've done. They're archived. For those of you who don't really know kind of what Taylor Medical is and don't really know what a GPO is, we are a group purchasing organization. We have a channel partner relationship with Provista, which is whom Blaire works for. And I'm sure she's going to explain in great detail what that relationship is and how you can benefit from the relationship between Taylor and Provista. But what I can tell you currently is we do cost analyses for you. We look at your practice and we say, okay, if you're using 100 widgets, we're going to give you a price on what we can comparably price those widgets at. And I call it like apples and oranges. We do two different things. What we do is exactly what you're purchasing within reason, because, for example, Medline is our med-surg partner. If you're using Henry Schein, you probably are getting a generic Henry Schein product when they're possible. And so we also use branded items by Medline as well. A really good example of something is, for example, if you're using Johnson & Johnson Band-Aids, everybody loves Johnson & Johnson. Well, guess what? Curate Band-Aids that you see in the pharmacy, which is one of the top-selling Band-Aids in the world, is Medline's branded Band-Aid. So what we'll do is we will do apples to apples, which is everything that you use with exactly. And then what we'll do is we'll try and substitute products that we think are just as good a quality, but that will save you money when you're doing that. So that's what we do with a cost analysis. Cost analysis is very easy. You can get to Carla, Ashley, or Brooke. You can send the products you're currently using in an Excel spreadsheet, or depending on which vendors you use, you can download your usage over 12 months in a digital file and an Excel spreadsheet and send it to us. We're going to look at it regardless, and we're going to give you a cost analysis with the help of Provista with our tiered pricings, which I'm sure that Blaire will also probably cover as well. So what I'd like to do is tell you a little bit about Blaire. She's been at Provista for over, well, she's been in group purchase for over 13 years. Most of her experience is in the non-acute industry, which for me, before I got into this, I didn't understand that it meant offices like we work in as opposed to hospitals and facilities. So Blaire is actually an expert or has experience in non-acute areas that we practice in. Her role is to support partnerships like Taylor Medical. She helps us provide cost savings opportunity downstream to members through the Provista relationship. I'm going to tell you, you're going to learn about things you don't know, whether you're getting Sherman-Williams paint for your house, peanut butter crackers for your diabetic patients who you don't want to bottom out, anything that you could think of that's not what you typically order from your med-surg vendor or your DME vendor, we're going to get those through our relationship with Provista. Blaire lives in Fort Worth, Texas, and spends her time keeping up with her kids and husband at home, volunteering for the kids who care, and attending Texas Christian University sporting events. So I am going to ask Jeff if he has anything that he wants to chime in and say. Otherwise, I'm going to turn this over to Blaire. Any comments, Jeff, before we get started? Nope. We don't hear you.
How about now?
Now we hear you.
Okay.
Hello.
Yeah. I would just say that to all the members out there watching is that I think what will happen is a GPO, we've all learned a little bit what that is, and that's what Taylor Medical is. But we joined forces, as Ira said, with a much bigger one after searching around a couple different places. And the one that we're with, you're going to hear about tonight, will just offer you so many things that Ira and I were not allowed. Well, we didn't, not whether we're not allowed, but we could never have got we have rates on Band-Aids and gauze and crutches and cam boots and stuff like that. But this allows you for staples. It allows you for Verizon. It allows you for stuff that we would never be able to negotiate. We aren't big enough by ourselves. So we joined forces with a bigger corporation, obviously a bigger partner, GPO, which we call our channel partner. And that's what we're here for tonight. So it's pretty interesting. And there's just a lot of ways to save money is what you realize. And that's what we're all going to try to learn a little more about tonight. So take it away.
Well, thank you, Jeff. Thank you, Ira. I appreciate it. And as you're saying this, it is a spectrum of possibilities outside of your just general medical surgical supply. So I appreciate you letting me take the time and come and present to your members today. So today I'm going to do a quick Provista corporate overview. Again, Blaire.Bendian, I'm the senior sales executive here at Provista. I manage the Taylor Medical relationship. We work together to leverage not only your membership, but the full portfolio and Provista relationship to ensure that you get the best cost savings for your sites. Okay, moving forward. So what is a GPO? And I'm not sure if my little video will come up as this is in a different slide. But what is a GPO? So purchasing by yourself is expensive. We leverage members like yourself to be able to combine that purchasing power to drive down cost savings for contracts that you utilize on a day-to-day basis, help you implement those, and then your suppliers and distributor partners provide that product to you, the same goods at a lower cost. And again, that video will be provided with the hard copy PowerPoint. So as Ira and Jeff were saying, who is Provista and Taylor Medical? We are your group purchasing organization. Taylor Medical focuses in the podiatric space and leverages Provista. We are a non-committed with no membership fee group purchasing organization. We are the most experienced in the industry. We are able to use the largest portfolio and leverage $135 billion worth of spend. And on top of that, provide you an additional suite of services, not only on procurement solutions, but analytics, just like Ira was mentioning with cost studies and no hassle contract implementation. Our partnership with supplier and distributors is all about connections. With our dedicated teams and of course, Taylor Medical, we have everything you need to access the best cost of goods and services to meet your supply chain demands. So we have unmatched purchasing power. When I say that, it's $135 billion. It's 2 times the purchasing power of our competitors. We are excited to go to market and work with our suppliers for a robust portfolio so that you can have access to it. So what does that really mean to you? With $135 billion worth of purchasing power, we're able to leverage 310,000 members to negotiate 3,000 contracts that provide an average savings of 14% for you. And again, we're looking at members that are 97% retained through this program. Again, we're looking at cost savings for you through the Taylor Medical and Provista relationship. So how do we team up for success? So Provista and Taylor allow distributors and suppliers access for you to be able to access the pricing and savings that we negotiate. And our suppliers and distributors provide that value back to you. And at the end, you are winning with those member value. As Ira was mentioning, we're not just Band-Aids and gauze and everything and traditional wound care. We are anything that can outfit your facility. Again, from paint to trash can liners, flooring. If you need any facility management, any maintenance and repair like Granger, looking at wireless services like AT&T, Verizon, we are here to help you drive down cost savings for your facility so that you can focus on patient care as well as be able to drive down your bottom line. So what does that mean? What access do you have as a member? Not only are you accessing the general Provista portfolio, which again is 3,000 different contracts, all at your choice to be able to access, but able to review data analytics with Taylor Medical on your cost studies, be able to review supplier sales reporting that you're accessing through Provista, working on contract implementation at no hassle to you. And we're able to coordinate with suppliers and distributors on your behalf. On top of that, we're able to provide supply chain services with aggregation with Taylor Medical and also any additional custom contracts that we make just for Taylor Medical here at Provista. That sounds fantastic. I'm excited about savings. What do I do to sign up today? It's no commitment, no membership fee. You have access to it for being a Taylor Medical member and you want to get started today. So what does that onboarding journey look like for you? It's very simple. You need a member ID number. If you don't have a member ID number, you can go to the Taylor Medical website and go to Enroll Now, scroll down to the bottom at the Provista, continue to the Provista form. You can complete that information. Make sure you include your DEA and HIN so you can not only access the medical, surgical, and purchase services, but also our pharmacy portfolio that is very large and robust. Make sure that you include all of your locations to that form because suppliers look to see that if you're a member, that all of your addresses are a member as well. Once you have signed up, you get a member ID number. You can then enroll into the Provista member portal, which I will discuss a little bit further, but it allows you access to view the full catalog to see what we have available for you. And again, 2,000 plus, I say 3,000 plus agreements, but I wanted to highlight specifically the top agreements that we have in suppliers that Taylor Medical has within the Provista relationship. So with medical surgical supplies, Ira mentioned Medline. Medline is a primary distributor for the Taylor Medical program. With BD and 3M, BSN, DJO, anything that you can think of, we have national brands at your service as well as Medline branded products. Office supplies, not only with office products like Staples, but we have FedEx. If you're shipping, if you have an account number, just let your Taylor Medical rep know or me, and we can get you connected quickly to the discounted pricing, as well as Pitney Bowes. Regenerative Biologics. Osiris is another large contract that we have here at Provista that you can leverage. Hey, you need new computers and IT. We have CDW, PC Connection, Insight Direct, as well as Dell. Again, pharmaceuticals is a high volume within some of your sites, especially with Pfizer and lidocaine. We do have that particular product and pricing on the portfolio. Exam room products and equipment with Midmark, and Taylor Medical has an aggregated tier for Midmark today, which allows you for deeper savings for your facility. Instrument repair, cellular and wireless services with Verizon and AT&T, not only for your corporation, but we do have an employee savings opportunity with wireless as well that even your employees can take advantage of. Waste management, like Daniel's Smart Shop, Sharp Smart, and Stericycle, language and transcription, medical coding, and of course, patient engagement. So if you need any follow-up, any surveys, anything of that nature, we have Panda, which is a great supplier here at Provista. So okay, those are the top contracts that Taylor Medical members are using today. I have a member ID number. I'm in the catalog. So what do I do next if I'm interested in a contract? Once you're in that portal, there is a purple button that says activate now. And that will then trigger a request to go to myself and the Taylor Medical team to ensure that you are implemented to that new contract and that you have that you are able to access those agreements. Let me go next. So the Provista portal, and this is to ensure that your materials managers, or if you're doing your own purchasing, that it is basically your right-hand man. It is here to help you save the day. It's a secure online resource where it has your information. It keeps track of the contracts, spend and savings, and new opportunities through the Provista portfolio. Again, we call this your new superpower because we are here to support you. We're here to make sure that you're getting the cost savings that you need and that you are able to focus in on patient care and that bottom line. So it allows you access to the contract catalog, again, 3,000 plus contracts that you have access to, and it's at your choice to be able to access those contracts. Purchase and spend reports. Hey, I'm accessing 3M today. Am I accessing the Provista agreement today? Am I seeing sales coming through? Your contract information, any contracts that are expiring or new, or anything else that comes through on the implementation process are notated into your catalog. Any current promotions that are just for you, we have quarterly group buys that you can take advantage of, and anything that's specific to the podiatry class of trade that we highlight for you. And then it's a way for you to connect with myself and the Taylor Medical team. If you have any questions, there's a way that you can contact us through the portal, and we are able to access that information and be able to connect back to you. Again, it's your new superpower, and we're here to help you access it and be able to, again, drive savings for your facility. So what are the next steps? So when purchasing, you need to let your supplier partner and distributor partner know that you are a Provista member with that member ID number. Register for that Provista portal so that you have access to see what all is available for you and you can leverage it. And if you have any questions, please reach out to myself or the Taylor Medical team at this number. And we're here to support you through the Provista Taylor Medical relationship. Before I go to questions, I do want to highlight the fact that Taylor Medical is a strategic partner of Provista, and we're so excited that they are here really focusing into this specialty, and we are looking to leverage and be able to make sure that you are getting your needs met. So Jeff or Ira, are there any questions in the queue?
Sorry, Blaire, I needed to get myself back on.
No, you're fine. I know I went through that pretty quickly, but at the end of the day, we are a large GPO, no commitment, no fee. We're here to focus in on savings and be able to leverage the relationship that we have with Taylor Medical and be able to provide specific contract aggregation for Taylor Medical members.
We have a lot of people listening we can see right now. So why don't we give a couple minutes, Ira, and see if they want to throw any questions, at least in the type box, and you can read them off. I think Ira has control of that. The only thing that I will add is some GPOs, when you go online, do charge a fee, and there is no charge for Taylor Medical, and there is no charge for Provista when you do it through Taylor Medical, which is nice. So just a nice little fact, something else for free. So what do you got, Ira?
I am. Blaire, I know that you explained that there's an online catalog that people can look at. Is there a cheat sheet that talks about the different categories that people can look about, and what is the best way for them to be able to see, what they will do? And I think I have a follow-up question after that.
Mm-hmm. Yeah. So, of course, after this call, I do have a follow-up PDF that explains how to log into the portal. but I will also include a top checklist that it shows all the top different product categories that we have and some of the vendors that you may be aware of. So when you go into that catalog, you're searching for a product or a supplier, you're able to see, oh, I know for a fact that Provista has this specific supplier like CDW for IT, and you can be able to go in and be able to review that agreement.
Okay.
Yes.
Go ahead. No, go ahead.
Oh, and then as it relates, and I think a follow-up question from that was, how do they know if something's on the portfolio or anything like that? At the end of the day, with the cost analysis that Taylor Medical will be doing, they're going to be managing majority of your medical surgical supplies. So that will be taken care of by the distribution partner as well as MedSurg. The catalog would be great for any direct contracts that you may be accessing, like Osiris, or any purchase services like Stericycle or Cintas for your facility.
Okay. One of the things that I thought was interesting, Blaire, that I don't think people also think about is the fact that they can utilize this for things at their home. As a member with Provista, if they are remodeling their house and they want to get Sherman-Williams paint at a discount or other household products, when we talk about Provista, I think that it's not just for your practice. There are advantages for your life in general, and I thought maybe you could touch on some of that with everybody and talk about a few things, that might be beneficial for them, where they think that they can benefit from this outside of just the office space.
Yeah, of course. So we have a full employee program, and what that entails? What does that entail? Well, it entails it's a website. It's a website where any of your employees can go online and they can get direct access to discounts within their zip code. So, hey, they want a Costco membership. They look up, Costco online, and they're able to see a discounted pricing. I've actually used the employee program savings for Disney World tickets for my family, or hotel discounts. It is another avenue to be able to go in and get access to additional savings for not only yourself, but your employees. And it's a good perk for your employees to be able to have access to those discounts. As it relates to some of those like paint, like Sherwin-Williams, we also have like AT&T and Verizon. We have employee discounts downstream for them as well that they can have access to. So again, it's a great perk, no charge, no commitment, no fee to have access to these programs outside of just what is needed for your particular practice.
Okay. So I know that you mentioned a variety of them, and I don't know if you have it directly in front of you. Mm-hmm. Obviously, we are partnered with Medline. So I guess my question is, what are the top 10 go-to vendors for savings for DPMs in their practice? We don't, as podiatrists, we don't have, I think, a huge bandwidth of things that we purchase. Yes, we do buy equipment and capital equipment and X-rays, mm-hmm. but what would you think are the top 10 vendors that maybe our DPMs wouldn't be thinking about, if that makes sense?
Outside of like regenerative biologics, or
exactly.
Okay, outside of that, of course, Cintas. I mean, fire safety, first aid kit, anything that you need for your actual site that, your mats. Our Cintas program is very robust, and there is, a step to be able to access that because you have to work with the local Cintas rep. But that's a huge agreement that we have here at Provista that can really service a variety of different product categories for you. If you're doing any maintenance and repair at your actual site, if you're in charge of that, we have Granger, who is another good, I guess, supplier in that space that you would not think about. Not only with office supplies, with staples, but they actually manage, your environmental supplies, like your hand sanitizer, your cleaners, anything like that. If you need that to outfit your facility, we have a contract on their facilities management as well. And then again, like some people are looking for new tablets or new ways to integrate technology. We have Insight Direct, that's a good partner with Provista in the non-acute space, that really assists in the technology piece as well.
One of the other things I think, Blaire, that I know that a lot of people have been engaged with is I believe that it's still something that we're doing through Provista is credit card processing. So I think that there is a significant savings. People don't realize what they're spending on credit card processing. So, and that's why when I talk about these things, I want people to realize what Taylor Medical is really capable of doing for them with the things that they offer. So I was thinking about the credit card processing. Something else that I have used for a few clients that maybe you can expound upon is some of the consulting services that you have available. Like I know that when people were developing or building surgery centers, or maybe a new practitioner is opening up a clinic and they need somebody to help with the layout of what an office would look like, I believe that you guys have consulting services that will help these people. I don't know if you can expound a little bit on those consulting services that might be available.
Yeah, so we have a full capital and construction team in portfolio. Depending on the need, we can either have consultants assist in outfitting and building out the full surgery center and buying all the capital equipment, as well as help with the contractors in accessing the actual construction portfolio. It's very robust. We also have another supplier called, why am I blanking on their name? I'm blanking on their name right now, but I will get back to you on them. They are only focused in on updating, like if you need a remodel, like paint, flooring, anything of that nature. They focus in only on that, and they are your contractor on site where you don't have to use anyone else outside of what they do today. It's called Powerhouse. And they are fantastic if you're looking to renovate your facility, do maybe like an uplift of rebranding and getting some new flooring, some new paint, maybe some new doors out there. So anything from a full engagement to maybe, hey, I just need to replace some of my floors. And we have Shaw Industries and Mohawk Industries for our flooring as well.
Well, I have to say personally that I lived right next to Shaw and Mohawk for 30 years. Yeah. I benefited from my employee discount from my employees getting stuff there. So it's definitely something good. I'll tell you, Blaire, as I think more and more about this, and again, some of the things that y'all have done, or that I've actually accessed for my own practice, when I was with a larger group, and is even laundry services, linen services for your surgery centers. I mean, when you think about the breadth of really things that you can access at Provista, I think that there's actually so much that you can't remember to talk about everything. I mean,
right.
We talk about shredded or waste management. I guess one of the other things, though, that I think is that people are interested in knowing, and I've had questions about it, with some of these ancillary services, do they have to sign long-term agreements, or how do we how do we do that? And what is their commitment if they want to use any of these services?
Yeah, of course. So if you're talking about on our portfolio, other suppliers that are providing, we call it a purchase services. So a service outside of just the actual product, right? They're not delivering a product, they're delivering a service to you. We negotiate with it in purchasing agreement. We negotiate the terms and conditions. We are able to provide price protection, as well as our standard terms and conditions throughout the entire life of our contract. But an end user agreement is required at the local level because of that service. Depending on the contract, and I always say this because each contract is negotiated a little bit differently, but depending on the contract, there may be a commitment for them to have that end user agreement. for that relationship. But there's always, again, terms and conditions in there and looking at those out clauses as well.
I would say one takeaway I get a lot too is when we're at shows and people come up to me and they'll tell me what they used you for or what they used Taylor for, Provista or Taylor. A lot of times I call it I didn't know that. And so many of them will say, wow, I didn't know that you guys had that. Wow, I didn't know you guys had that. So I tell everyone, I said, it doesn't cost anything. Just, call Provista, call Taylor, one of the two, and say, can you guys get this for me? Save me money, because a phone call might save you $20, might save you hundreds, or might save you a couple $1,000s. So it's worth it. You're part of it now. We've spent a lot of time and effort getting it ready for you guys, but most people will say that if I only knew, and then they go to it after the next day. They usually lose on the first, then they realize it, then they come to us for the second.
And I completely agree with that. I think, when you think of GPO, you hear med surg supplies. That's not a GPO, especially with the Provista Taylor relationship. You have to look outside of that. You have to look at everything that is outfitting, not only your facility, but potentially your employees. That's why I really recommend, signing into to those particular, that catalog, because, hey, I need to purchase this. Let's look online on the Provista catalog first to see if it's even there, and be able to work with us and be able to provide those additional cost savings that we are negotiating. And again, those terms and conditions that we negotiate, we do that for the lifespan of the contract. And so we highly recommend checking with us first to ensure that you're getting the full value of an agreement. Yeah, and a question came through as it relates to how many vendors or contracts does Provista have access to for Taylor members? Again, that's 3,000 different contracts that you have availability to, and that's plus some. It's based by category, how we negotiate, and we allow you to have the choice to be able to access those agreements.
So I know that you already explained it before, but we did get a question about how easy it is to sign up. Do I go through Taylor or through you? So I know you spoke about it, but maybe you can reiterate that for our member.
Yeah, of course. Please go to the Taylor Medical website to join Taylor Medical tab. You can scroll down to the bottom. It says Provista enrollment. That's where you will enroll. It is a custom Taylor Medical link, so that we know that you're part of Taylor Medical and we're able to roster you as one.
Thanks.
Yeah.
Jeff, do you have any other comments that you want to bring up? Or any other questions that you can think of?
Like I said, I think everyone thinks is, if you think if you need to buy something, make sure you're not paying too much. That's all we ask, because a lot of times you'll be surprised.
Well, you know what, Blaire? This doesn't always go the full hour sometimes. I think that we're grateful that our members leave their families and their private life to join us for a short bit of time. Before I talk about next week's webinar, I didn't know if you had anything that you wanted to close out with any comments from Provista before I thank everybody for joining us and tell them about next week's meeting.
Yeah, of course. Well, again, thank you for the time to come and speak to your members, and thank you to the members for taking the time out of your evening to learn a little bit more about Provista and the Taylor Medical GPO. As I stated before, we are going to send out a follow-up PDF on how to sign up to the program, kind of top contracts, how to sign up to the catalog. But I will also include a checklist as well as an employee program flyer too, so you can see that and be able to provide that to your employees.
Perfect. Thanks.
Great.
Well, next week we have one of our other founding vendor partners, SureFit. Joining us is going to be Nick Turner, the Director of Sales for SureFit, and Scott Belansky, the Senior Manager of Sales for SureFit. And, I think what they're going to do is they're going to dive into strategies to recharge or resuscitate your practice's therapeutic shoe program. They're going to cover the basics of the therapeutic shoe bill, strategies and tools. They have a portal they're going to teach you about to help you get the paperwork. They're going to show you follow-up. They're going to teach you about recall campaigns. A lot of people don't utilize that in their practice to help generate patients and remind them that they need to come back. Therapeutic shoes are here for a reason. I don't think they're utilized enough by podiatric physicians, and I think that learning how to implement and using the technology that SureFit has to offer is going to help improve your practice's diabetic shoe outcomes. So with that, I'm going to tell everybody good night and thank you for joining us. And we'll see you next month. Dr. D, thank you for joining me today. What a pleasure. Blaire, thank you very much.
Thank you.
All right. Bye, everybody.